to us. I can't tell you that it is completely over, but I surely hope and pray that this is the last part of it. I do not know that for sure, but nevertheless, I can tell you that it is unacceptable to me in every way, and we are going to fix this. And I'll tell you in just a few minutes what we're doing, or maybe I'll just tell you right now. But at my direction, we are installing a new electronic death reporting system. West Virginia is one of the only states, now just get this, one of the only states in the country that does not have that. We probably didn't need that in West Virginia, and at least we didn't think we needed that until we got into this situation. But once we got in this situation, our people at DHHR should have recognized this issue and moved. They didn't move and everything, and I'm not happy about that. But I can tell you that it is clear that our investigation has concluded that there was no wrong or no willfulness intent, that was to report incorrect data. So you don't have anybody that is out there that is purposefully doing something that we can get our hands on right now, but nevertheless, let me read these deaths, and then we'll take your questions and try to answer them as best I possibly can. There's, like I said, there's a problem in many, many states with just this at a higher magnitude than what we have, but they have a higher number of deaths than what we've had too. And so let's be perfectly fair on that as well. And due to the lag time to prepare, submit, and issue a West Virginia death certificate, it is not possible today to use a death certificate for near real-time reporting in West Virginia. So that has got to be changed, and we've got to get off the bubble and change that, and we've got to do it right now. And we should have already done this, and so with the help of the National Guard, we're on it, and we're going to get this fixed. And the only other thing I would offer up today is that all of you would offer up a prayer for Bill Crouch and his mom. I think that his mom's having some level of surgery and is in not great shape right now, and so he's not with us today. But if you offer up a prayer for Bill and his mom, it would be really, really, really kind of you. Okay, as far as the deaths in West Virginia, our 2,639th death is a 74-year-old female from Raleigh County. Our 2,640th death, an 84-year-old female from Raleigh County. Those were the Tuesday deaths. Today's reported deaths, our 2,641st death is a 74-year-old female from Berkeley County, and our 2,642nd death is an 84-year-old female from Putnam County. Now, the unreported deaths that I hate this so badly, because we should be so respectful of these people and everything. And it doesn't matter to me really what's going on in other states. It doesn't really matter to me, why this has happened, whether it is, has any intentional intent in any way. It only matters to me one thing. These people deserve our respect and our love. And I'm sure we have both. But to absolutely not report them timely is not good. And I don't really know if it has come from a nursing home or a hospital or within DHHR. I don't know. But I know that they're just getting to us, and so please bear with me as I read these names, or read these great people. The 2,643rd death is a 34-year-old female from Wayne County. Sheesh, 34 years old. Our 2,644th death is a 78-year-old male from Tyler County. Our 2,645th death is a 93-year-old female from Preston County. Our 2,646th death is a 47-year-old male from Wetzel County. Our 2,647th death is a 78-year-old female from Pocahontas County. Our 2,648th death is an 87-year, I'm sorry. The 2,647th death is a 78-year-old female from Pocahontas County. Our 2,648th death is an 88-year-old male from Randolph County. Our 2,649th death is an 87-year-old female from Ohio County. Our 2,650th death is a 78-year-old female from Logan County. Our 2,651st death is a 73-year-old male from Cabell County. Our 2,651st death is a good gracious. This has thrown me so off balance. I hate this so badly for these people. Our 2,651st death is a 73-year-old male from Cabell County. Our 2,652nd death is an 89-year-old male from Wayne County. Our 2,653rd death is a 67-year-old female from Marshall County. Our 2,654th death is a 93-year-old female from Mercer County. Our 2,655th death is an 85-year-old male from Putnam County. Our 2,656th death is a 78-year-old male from Greenbrier County. Our 2,657th death is a 73-year-old male from Berkeley County. Our 2,658th death is a 92-year-old female from Jefferson County. Our 2,659th death is a 78-year-old female from Logan County. Our 2,660th death is an 80-year-old male from Braxton County. Our 2,661st death is a 92-year-old female from Wetzel County. Our 2,662nd death is a 56-year-old female from Kanawha County. Our 2,663rd death is an 84-year-old female from Greenbrier County. Our 2,664th death is a 67-year-old female from Kanawha County. Our 2,665th death is a 63-year-old female from Clay County. Our 2,666th death is a 91-year-old male from Hardy County. Our 2,667th death is a 79-year-old male from Mercer County. Our 2,668th death is a 78-year-old male from Mineral County. Our 2,669th death is a 56-year-old male from Upshur County. Our 2,670th death is a 68-year-old male from Kanawha County. Our 2,671st death is a 59-year-old male from Putnam County. Our 2,672nd death is a 78-year-old male from Harrison County. Our 2,673rd death is an 81-year-old female from Boone County. Our 2,674th death is a 68-year-old male from Hancock County. Our 2,675th death is a 95-year-old female from Wood County. And our 2,676th death is an 86-year-old male from Monroe County. Please keep them in your prayers. Please, please do. You can't let them become a number. I hate like crazy that these certificates didn't get to us, or I hate that they weren't processed properly within our system. We're changing it, and that is exactly why I'm directing DHHR to immediately begin the process to implement a new electronic death reporting system. There's all kinds of stuff, the repercussions of this, the loss of our wisdom, all kinds of loved ones, everything there is, and that's ever so true. But these people wait on death certificates. They have funeral expenses. They have life insurance situations, lots and lots of situations that they have. Now, I promised an investigation. And I promised that absolutely the report would be available to you, and it is available to you this afternoon. You know, I hate this. I'm sorry for this. The numbers. The new positive cases are 416 in West Virginia in the last 24 hours. We tested a lot. Our positivity rate is at 3.64. Our cumulative positive rate still goes down at 5.26. Our active cases are 6,278. That we surely were significantly better than that not long ago. Our recovered cases, 132,784. We have over 237 people hospitalized and 80 in the ICU units, and we still have 2 counties in the red, that's Berkeley and Raleigh. I remind you over and over, this thing is not over. It is not over. You know, a lot of states ran out and said, well, we don't need this mask anymore and everything. The Biden administration right now is saying, appealing to all states to make your mask mandatory. Now, there's a lot the Biden administration is doing that I absolutely disagree with adamantly. You know, if we don't watch out with the Biden administration, we're going to awaken to a country that we will not even know who we are. We got to watch out about that. Now, and I tell you all across our land in West Virginia that today we see some thunderclouds. The thunderclouds could be what's happening at the border as far as all the immigrants coming. You know, from the standpoint, illegal immigrants in many, many ways. You know, we see what's happened in Texas when the cold weather hit down there and millions were without power and everything. And all the different problems that broke out, and we're shutting down the Keystone Pipeline. We're absolutely deciding that, you know, what we need to do is get completely away from fossil fuels. I truly believe with all my heart that there may be a day in the future that is achievable. But today, if we do such a thing as that, we're going to awaken to an absolute tsunami at some point in time. We have got to right ourselves here. You've got teachers in San Diego right now that are deciding that they're not in school. Their kids in the U.S., the USA, their kids, they're saying leave them out of school. But let's do this. Let's go and give an in-person instruction to those that are, you know, illegally in a lot of ways coming into the U.S. Now, look, we just got to get right side up in America. I mean, that's just all there is to it. The sad part about all those people that are trying to come to America, they know America is the greatest place on earth. And they're trying to come. And they're trying to leave problems that they want away from and everything. And you know what we're going to end up having to do? Those kids and stuff that are there, we should take care of those kids. Those kids and probably their parents that are there will end up in the United States. But you know what is the crying shame? Is we have enticed them in the Biden administration to come. That's what we did. And as they came on the trip, several probably died along the way. And now they're here. And now all of a sudden we say, uh-oh, we got a real problem. Well, if we were going to entice them to come, we should have been prepared for them to be here. But now, uh-oh's not good enough when you've got 500 and some kids jammed into a facility that can only hold 30 some. It's not good enough what's going on. You know, and so we just got to get right side up. That's just all there is to it. Let me get back to what I should be on. I'm sorry. You know, but, you know, with the 2 counties that we have that are still red, and with my urging of you to just, I don't like these masks, but just continue to wear your mask for just a little bit longer. Until we can get enough of you vaccinated that we can get rid of this terrible killer. I remind everybody 65 years of age and older, if you've got that sniffle that I talk about or a headache, go get tested, please. It's free, it's painless, and if we can catch this early enough, we can give you the antibodies and knock it out. You know, as far as our vaccine eligibility, we've opened up to anybody age 16 and older, you know, to be able to get shots when we have shots available. You know, we're at 97.9% total administration right now of first and second shots. The goal is always 100%. We have now in the arms of West Virginians 812,015 doses. It's amazing. And the job that's been done by all of our health officials, the National Guard, the DHHR, hats off to them. They've done incredible, incredible work. Our allocation increase is going up. Next week, our vaccine allocations from the federal government will increase from approximately 52,000 this week to 72,000 next week. And I have ordered the Joint Interagency Task Force to increase our capacity to deliver the vaccines in our Eastern Panhandle and amp that up as well as all across the state. General Hoyer will tell you more about that in just a few minutes. You know, as far as the saving our wisdom clinics and everything that when we moved immediately, gosh, I could never, ever tell you how proud I am of these numbers and everything. I tell you this every day, but 236,000 individuals 65 and older have got shots in their arms, and 117,000 of them have their second shots. You know, and that means that when you add up these doses from the Veterans Administration, the Federal Pharmacy Partnership with Walgreens, and now Walmart coming online on top of that, we are over 72% of our total population in this state of 65 and older, with our goal to exceed 85%. You know, it is really working, and we have saved a bundle of lives that where we had people that were anxious beyond belief. They didn't think they were going to get a shot until, or even be on any list until April. And, you know, all this started back in January, but 236,860 people have got a shot in their arm right now that are 65 years of age and older. And I can't tell you exactly how many. I can't tell you if that number's 100,000, 150,000, 10,000, whatever it may be, but we saved a pile of lives right there. That's the number I'm the most proud of all these numbers. You know, our vaccine scheduling system is up. It'll take you 10 minutes to register and everything. Anybody 16 and older, you can do it and do it right there. You know, our manufacturing outreach that we did there, our Joint Interagency Task Force continues to reach out to manufacturers and businesses across the state to increase access to their employees and their families choosing to be vaccinated. You know, if you have a facility and you want to host a clinic, please call our vaccine info line, and they'll get back to you and everything and get that all in place. You know, as far as our churches go, General Hoyer said on Monday, we want to offer vaccine clinics to all West Virginia churches also. If you're a church pastor or if you have a congregation that hasn't had the opportunity to get vaccinated, contact our info line and we will work with you to get your congregation vaccinated. You know, our COVID-19 vaccine info line is up. You know, our vaccine reminders, please don't listen to the garbage that this is going to hurt you and everything else in taking the vaccine. It is so safe. I encourage. If you choose in your heart to not take the vaccine, personally, I think you're really making a mistake. But personally, I'm not here to do personally stuff. I'm here to do the will of the people. And that is your right to not take that vaccine. I don't necessarily believe it's your right to stand on a soapbox, even though you have freedom of speech, and encourage all kinds of people around you with fear and everything, so you won't be the only one that doesn't take the vaccine. But absolutely, I still encourage you, please reconsider. Taking the vaccine only will save your life, and I feel very strongly about that. You know, from all of our testing sites up, all the free testing stuff is up. You know, we thank Frith and Walgreens over and over for all the great work they did. We have 4 outbreaks in our long-term care facilities, 6 in our churches. We dropped down 1 there. 5 counties, though, Harrison, Kanawha, Fayette, Raleigh, and Nicholas counties. I think we had Monongahela County in that. I'm not really exactly sure, but but we're getting a little bit better there. Correction is still unbelievable. Can you imagine that in the entire state of West Virginia, on all the corrections facilities today, we have 3 inmate cases and 12 staff cases in the whole state? It's amazing. It's absolutely amazing. And I'm sure, as the general reported on Monday, we're moving forward to get our corrections people, all of our inmates and all of our staff there and everything vaccinated as well. Our guidelines are all up. I tell you over and over about the face coverings, and I ask you and plead with you, please consider giving blood, especially if you've had the blessing of life given to you, that you had this dreaded disease and you got over it. So that's all I got right now. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor discussed with us just now, that we continue to do well relative to the rest of the country, but we are also seeing an upswing in the number of cases over the last week. We've seen a plateauing in the number of deaths. We still have seen a dramatic 87% reduction since the beginning of the year, but we're also seeing hospitalizations slowly tick up. And we know that the age of people who are becoming infected is starting to go down, with an average age of about 34 years old. We've also detected 53 United Kingdom variant viruses, mostly in border counties with other states. And we've also detected over 130 of the California variants that are not nearly as lethal or deadly as United Kingdom variant, but spread about 20% easier and generally spread among people who are asymptomatic. So we don't say that to scare anybody, but we do recognize, as we're seeing around the world, that the countries that vaccinate the most aggressively and the countries that vaccinate both their older population, which absolutely saves lives, we know that, and also their younger populations are the countries that are doing best, and approaching 50% of the population vaccinated. And we have probably a few more weeks to get to there, but having that level of vaccinations seems to be a hallmark of countries like the United Kingdom and Israel that do relatively better. So what we're doing now is trying to buy ourselves time. Good news, the Pfizer vaccine was shown to be 80% effective in a group of younger workers by the CDC, even after one shot, 2 weeks after one shot, and 90+% effective after 2 shots, and 100% effective against hospitalizations or deaths, as we've seen before. That's good news. And also there's a Pfizer vaccine trial in younger people, 12 to 15-year-olds, that looks like it was well tolerated and 100% effective in the groups that were vaccinated. So that vaccine will also likely very quickly, and that data, be moved to the Food and Drug Administration. So hopefully we can extend the vaccine opportunities to younger West Virginians. And we do know that the younger people are the people where we're seeing more spread. And we're also seeing now that move also from that 10 to 30-year-old group starting to move into the 30 to 39-year-old group too. And that just tells us that the virus is spreading in many groups now. Younger people certainly more commonly, but we really do, as we buy more time, need to be still careful, wear masks, stay physically distanced. And when you have an opportunity to get the vaccine, please get it. I think people are still, some people are hesitant to take the vaccine. All of us on this call have taken the vaccines ourselves. We've had our families who've qualified for vaccines get vaccinated, and these are the people that we love the most. So we trust implicitly that this is a very safe vaccine, and we know it's an amazingly effective vaccine. And in the states and the countries that have vaccinated their older population, they have seen dramatic decreases in deaths and hospitalizations, and particularly of this very vulnerable population. So West Virginia, please stay the course. you're doing great, but it is not time to give up and let down yet. We want to stay very, very diligent so we can immunize more people. And as we start to see our, number of vaccinations increase, then we know we've not only saved lives, but we've slowed down the transmission of not only the virus, but also variants of the virus, and not allowing them to grow in West Virginia. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. Just like to reinforce and highlight a couple of points that the governor made. Vaccine numbers will increase significantly next week in our central hubs from 50 to 72,000, give us a lot more flexibility. As the governor pointed out, we have seen some challenges at the local level in the Eastern Panhandle with ability to get vaccines out and maintain other services. So we have worked with West Virginia University Health Systems, Health Sciences, as well as WVU Medicine, the hospital system, and the local level through the Joint Interagency Task Force at the governor's direction to increase the capacity to deliver vaccines in the Eastern Panhandle. That effort is beginning as we speak now, and will ramp up significantly next week as we see more vaccines. We continue to work on ways to innovate to get vaccines in arms. As the governor pointed out, we challenge all churches, their pastors, and their congregations to contact us through the hotline. Contact us. It will go straight to the interagency task force that will work with local level leaders in our construct to help get vaccines to your church congregations. We also are continuing to work initiatives with manufacturing sector, the energy sector, and the retail sector to make vaccines available not just to essential workers, but also to their eligible family members. So we continue to work hard in those particular areas. In addition, we are working and planning now for what Dr. Marsh laid out, that what will come in the hopefully the very near future, and that is that we are preparing to help vaccinate 15 or 12 to 15-year-olds as that becomes available. So a lot of work continuing to go on. The other thing that I want to point out to folks, vaccinefinder.org. We are sending an additional 9,500 doses to participating pharmacies across the state. So you can go to vaccinefinder.org and look to see what is out there in those areas. And last thing, I want to thank Delegate Paul Espinosa, who has been instrumental in working with us as we increase the capacity in the Eastern Panhandle, working on behalf of all the legislative folks over in that area. Thank you.
All right, thank you, sir. Next to Dr. Aina Amjad, our State Health Officer.
Good morning. I do want to wish Secretary Crouch's mom our prayers and well wishes. Hopefully she gets home soon for the Easter holiday. Speaking of Easter, we do know a lot of families will be getting together this weekend, and we do want to remind everyone to travel safely. And if they are feeling not well, that we do have free testing events throughout the state. And to remind everyone that if you're not feeling well, if you have any cold-like symptoms, sore throat, runny nose, any of those symptoms, that to get tested. We do hear multiple stories at some testing events that people are feeling sick and they do get tested, even sometimes coming back several days later. So it is important to get tested. And then if you're with some family members, to still wear your masks if they have been from multiple family households, but to enjoy your Easter weekend with your families. It is a precious time, and we do appreciate everyone who's getting their vaccines. It is important to get vaccinated, as been stated several times. Thank you.
All right, thank you, Dr. Amjad. We'll go back to Major General Hoyer. I think he has one more thing to add.
You've got me, Jordan. What was I going to add?
Come on to me. Come on to me.
Okay, we'll go back to the governor.
Okay, no, let's go to the questions.
All right, we'll go to questions from members of the media. The first today from Mark Cram with WDVM.
Well, good morning again, and thank you all for your time. I know you're extremely busy, and I have to say, in almost 40 years of working in the news business, the transparency of this operation and administration is certainly commendable. I know, Governor, your heartstrings are tugged with knowing that the number of deaths was underreported. With that, and with implementing the electronic system, I know it's a question you've been asked before, but I'm going to ask it again. Would you reconsider dialing back the amount of which we've opened the state, given the fact that the number of deaths are up? Also, on Monday, I had asked the question about data that's available on the demographics of the uptick in cases. And if I'm correct, I think Dr. Amjad mentioned that what is being gathered is data for those who have gotten a shot or had their complete shots and then got the virus after receiving the shot. I'm wondering what that data is showing, or is it too early in the game to really ascertain any particular helpful information? Thank you so much.
No, Mark, thank you, sir, and I appreciate the kind words. I want it to be right. I really, really do. But as far as dialing back, sir, where we are today, I mean, 2 deaths on Tuesday, 2 deaths today. The progress is phenomenal compared to where we've been. These are deaths, that have been in the system a long time and just getting to us, and so to react on these deaths, I think, would be a foolish move. I'm not interested in dialing back. I'm interested in moving forward, and I'm always keeping that in my back pocket. If we have to, we'll adjust, but this is not a time that we have to adjust. I think we're making real progress on shutting this thing down. If we can just continue to get all these shots in arms, and we have a challenge in Eastern Panhandle, and we're going to run to the fire there and try to get that knocked out. We have a challenge, with our corrections, and I know that what we're doing, we're immediately moving to get shots in the arms of everybody in our corrections that are 65 years of age and older. We'll fall right from that to 50, and we'll just stay at it until we get them all vaccinated, all that will accept and take the shot. So we're on it, and Dr. Amjad, you're going to have to answer the other question, because it's not for me.
Sure. To answer you simply, it's too early to tell, but we are trying to merge our case data and vaccine data. But we basically have to ask our new cases, have you gotten a vaccine? Have you gotten your first dose, your second dose? So we do look at that, but those cases, by our case investigations, they have to merge that data, put it into a system, and then look at those case investigations. So we do track that by our epidemiology team, our case investigations team. So they're tracking that, and they have to merge it and to come up with that information to see that. But that is important to see, and those are breakthrough cases, or breakthrough if you've gotten the vaccine. So we want to see those reinfections. So we are watching those, because it's very important to see, if someone has a second COVID case, if someone has COVID after they've gotten the COVID vaccine. So that information is in our system, it's in our data systems, but they have to merge that information together and, run those reports for us to see. But that is being tracked by our case investigations team, our epidemiology team. That is information that we want. But to put out numbers right now, or that gross information, we don't have it, but we do look for that every single day to make sure, because that's what we want to know, how much protection the vaccine is giving us and so on. But I don't have a number to give out right now. Thanks.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Could you provide us with a little bit more detail about the electronic death reporting system? Will this be a system for all deaths in West Virginia, or just COVID deaths? Do we have an idea at this point what it'll cost and where those funds will come from? Do we have a timeline for how long it'll take us to get this up in place and running? Thank you.
Charles, I'm assuming this is for all deaths, not just COVID, and going forward in the future and everything. But I think General Hoyer, Bill Crouch, like I said, is out with his mom, and but General Hoyer, maybe you can give more clarity to this because I don't know all the specifics about this.
Governor, I think Dr. Amjad may be able to address this one.
Sure. Governor, I can answer that. Charles, I mean, it would be for all deaths in the state. We would have to get a statewide electronic system to report all the deaths, and then of course it would have to code for COVID-19. But it would probably I wouldn't have a cost on that. We'd have to investigate different vendors for that. But as the governor stated, we would want to implement this as soon as possible so that we can get it started as soon as possible so that we could have it running. But we have to look into that, but he's tasked us to do that as soon as possible. But we'd have to get onto that, and it would be for all deaths in the state, not just for COVID deaths. It would be for the entire state and all deaths in the state. Thanks.
All right, thanks, Charles. Next to Kenny Bass with WCHS and Fox 11.
Thank you very much for taking the question. I appreciate it. All the best to Secretary Crouch's mom. That's a tough situation at any time, especially during a major holiday. I hope she gets well soon. Governor, it is fair to say that you've had a number of successes with COVID. The state's done very well in many instances, and you should be congratulated on that. And you mentioned fairness when you talked about reporting on the deaths that were previously unannounced today, and that's also something that's fair to say, so to speak. But when you talk about technology and DHHR, I don't have a great amount of faith in that combination, and here's why. The Everbridge system, while it was a great intentioned effort, really failed in a number of ways. It couldn't even tell us how many people already registered on the system had gotten the vaccine. It just wasn't designed to do what we needed it to do, and yet it was still brought in anyway, despite what I know were objections from other parts of the administration. It was still brought in, millions of dollars were spent, and it just didn't do what we needed to do. So how confident should we be that DHHR, making the same information technology decisions, is going to come up with a statewide death reporting system that won't result in the same kind of fiasco, that it just doesn't work? I mean, good intentions are great, but at the end of the day, you have to have performance. And it seems like we're failing, at least in the technology end, where DHHR is concerned, in some areas of the pandemic. So how confident are you they can pull this off?
Kenny, if I were to be brutally honest, like I always am, my response would be they're going to pull it off, and they're going to pull it off in spite of themselves in a lot of different ways. From the standpoint of information and technology and everything, honestly, DHHR is just like a lot of things in government, has lived in the dark ages, and they move way too slow. That's why we're bringing the guard in, and we're going to get this and fix this and get this right. Now, to just tell it like it is, I am as disappointed as you could possibly be times 10 million trillion. I am absolutely just going to tell you just as point blank as I can tell you, there's no reason for this. Now, we did not spend millions on Everbridge. I think the cost was $700,000. I'm not sure exactly, but the system would have worked. The system in itself worked, and it did. It did make things a heck of a lot better than people sitting around, on the phone, placing 165 calls in a day and absolutely trying to get somebody to answer the phone. It worked in a lot of different ways, but really and truly, the system failed in some ways from being perfectly working because primarily of us. And so with all that, Everbridge saved a lot of inconvenience from a lot of different people. And for the money, if we had just done that, yay. But it could have been better if we would have done better. But Kenny, in this situation, just like that I've done all over the place. As soon as I really can see the problem and understand the problem, I'm going to run to try to fix the problem. And in this situation, we're going to fix this problem. You know, I almost said a bad word right then, but we're going to do that.
All right, thanks, Kenny. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel, and my best to Secretary Crouch and his mother. Governor, we have focused on this call on Save Our Wisdom, and I want to take a big picture approach to that with this question. I wonder if you had something bigger in mind when you were talking about Save Our Wisdom, because we both know that many older people don't have a lot of contact. They don't get to share their wisdom. People don't get to discover that wisdom. Is there a way that you or perhaps the state can help encourage people to use these older people as resources and as sources of wisdom in the future? Thank you.
Well, Paul, it's a great point. You know, it used to be that maybe we've lost our way a little bit on this as well, but used to be we really always took more time for family and took care of our families in surely a better way maybe than I think maybe we do today. But yet in West Virginia, at least in West Virginia, we have not gotten so wrapped up in so many things that we don't center our lives around family. You know, Paul, that wisdom that has been passed on to generation after generation makes us who we are today. It really does. And that's why, you know, I came up with the idea of the name Saving Our Wisdom, because as we save each and every one of those that could have passed away, especially each and every one of them, we still have the opportunity to gain more wisdom from them. And so, Paul, I would encourage everyone to take time and be with those that are older. They would love it beyond belief, and they need it in their life. But you need it in your life because they can bring to you so much wisdom that will help you throughout everything you do. You'll carry it with you to your grave. And so, Paul, you're dead on the money right. And we need to encourage that more on a two-way street, because those that are elderly a lot of times are alone, and that's not any good. That's not any good at all. And from the standpoint of what they have to give back, to the fact that, you know, rushing out and throwing that mask away and saying, you know, all things, it's over. Well, it's not over. It's not over. We got to run through the finish line on this one. And so just continue to be smart, and we'll get through it. But Dr. Marsh, you need to take over, please.
Well, thank you, Governor, and thank you, Mark. So we do know that there is a fourth wave that is coming from Europe to the United States, and some states have really had significant problems. I talked about Michigan on the last press brief, which has seen a over 600% increase in hospitalizations of people between 30 and 50 years old. And we know the variant, particularly the United Kingdom variant, is going to be the most dominant form of COVID-19 in the United States as well. And conservatively, it's 50% more infectious and 50% more lethal. And that comes from data from the United Kingdom. And the key for us, Mark, and this is what we've been talking about for now the last week or 2 weeks, is that West Virginia has done very well. And the governor has talked, you know, about all of the successes we've had, strategies, transparency, staying together, all so important. Now the time is very critical that we slow down the rate of spread. which we see happening in younger West Virginians, and allow ourselves more time to continue to vaccinate more and more people. The more people we vaccinate, the more it stops the spread of COVID-19, slows it down and stops it. And also it stops the spread of the variants, because the more people become infected, the more the variant viruses have a chance to replicate and then spread to other people. So we really right now are in a bit of a race between how fast we can vaccinate our citizens and how fast this virus spreads. And it's spreading in younger people. And particularly we see it in people on sports teams, and those are situations where people aren't wearing masks as effectively. And the good news is that we believe that the Pfizer vaccine will very soon be approved for younger West Virginians and Americans 12 to 15 years old. We can now vaccinate people over 16 years old. We have more vaccines, and it's really, really critical that all West Virginians, when it is your turn, when you have an opportunity to get vaccinated, please choose to do so. These vaccines are life-saving, they are game-changing, and for us in West Virginia, they are an essential component of our strategy to protect our state and continue to be the beacon for the rest of the country.
Gordon. Okay, I just want to summarize just one thing that Dr. Marsh said, and this goes back to getting vaccinated, and it goes back to getting vaccinated when we have the shot available to you. Now just think about this. Dr. Marsh is a super expert. He is our coronavirus czar. Now just think and stay right with this just 1 second. A super expert is telling you that this variant of this virus that's coming from Europe is 50% more infectious and 50% more deadly. Now you decide. Do you want to take the vaccine or not? Do you know anybody that has dropped over with the vaccine? I can name 2,676 people that have died from the virus. Do you want to take the vaccine or not? That expert, our super expert is saying 50%, the variant, this strain is 50% more infectious, meaning it'll spread 50% faster, and it is 50% more deadly. Do you want to take the vaccine? That's what you've got to decide. Okay, you're coming back to me now. Okay, we don't have any more questions. Okay, well, thank y'all so much for your questions, and really and truly, all I can add to this is, continue in this wonderful Holy Week, and happy Easter. I'll say that again on Friday to everybody, and just please stay the course, West Virginia. Get vaccinated. I encourage you in every way to get vaccinated, and I thank you for always continuing to pull the rope together, because that's what's gotten us here. I promise you, at the end of the day, we can say anything we want, but at the end of the day, what has gotten us to these incredible numbers and the spotlight of the nation and the world on us is you, West Virginia. You've stayed right with us. Everybody's pulled this rope together just like West Virginians do all the time. Thank you so much. God bless each and every one of you.